ADEX guidelines for the Gold 3X Metal Ceramic 5 preparation for the Typodont exam. This video is intended to help you pass your ADEX exam, but remember to refer to the preparation manual for further clarification. Assemble the armamentarium as shown here on the screen. As a tip, it's helpful to measure the diameter of your burrs in order to use the burrs for depth grooves in subsequent steps. Practice with the same burr type that you intend to use for the exam. Even if you get a new burr for the exam, this will allow the procedure to be as repeatable as possible and therefore cut down the chances of error. To begin, fabricate 2 putty indices to be used as reduction guides. To fabricate the putty, mix half a scoop of base with half a scoop of accelerator. Knead until the color of the putty is uniform and all streaks have disappeared. Adapt the putty to cover the labial and lingual surfaces of the tooth, as well as the corresponding surfaces of at least one adjacent tooth. Allow the putty to polymerize for approximately 2 minutes, or according to the manufacturer's instructions. Remove the putty and section the indices. As a tip, ADEX recommends making buccolingual and occlusal cervical reduction guides, but you can make as many as you would like to help with checking reduction from multiple angles. Always follow the specifications in your exam booklet for the reduction guides. For the buccolingual index, cut the index in half buccolingually, sagittally, across number 5 and number 3. For the incisal-cervical index, cut along the occlusal surface to separate the index into a labial and a lingual half. As a tip, make sure your putty is of the teeth that you will be prepping on your accidental typodont for the ADEX exam. Each typodont tooth is slightly different. For this reason, when you change out the teeth, make a new set of matrices specific to the exact teeth you are using. Do not recycle old matrices, as they may be inaccurate. As a tip, start by performing your gross reduction of number 5. Once you've performed the number 5 gross reduction, move on to the number 3 gross reduction. Leave tooth structure to allow for final refinement and taper correction to create a coincident path of draw between the teeth, which should be performed after both gross reductions have been performed. As a note, we've placed red utility wax in the edentulous number 4 site. While not used here for visibility purposes, we recommend using water cooling during this procedure to prevent the burning of accidental teeth. Once we have completed the putty indices, we can move on to the crown preparation, starting with the occlusal reduction on tooth number 5. Orient the burr perpendicular to the long axis of the tooth and parallel to the edge of the occlusal surface. Create depth grooves at 1.5 to 1.8 mm depth. This allows for the additional loss of tooth structure during reduction and finishing. Then, join the depth grooves together. Remove any roughness left by the grooves. Burr options include coarse to medium grit, chamfer, and tapered diamond burrs. Remember, however, that the accidental teeth are soft, so really avoid coarse grit unless you have a tendency to underprep. Also, preparations for PFM crowns vary depending on how many surfaces will be veneered with porcelain. Those areas will require deeper reduction than the portions of the tooth covered with metal alone. The instructions for this PFM prep assume that the buccal and occlusal surfaces will be veneered with porcelain, while the lingual surface will only be overlaid with metal. For the lingual portion of the occlusal reduction, create depth grooves at 1.5 to 1.8 mm depth. You should create 3 parallel to the lingual occlusal inclines. Join the depth grooves together. Burr options include coarse to medium grit, chamfer, and tapered diamond burrs. Compare your reduction against the buccolingual reduction guide and use your probe to measure. The final occlusal reduction is 2 mm, but it is unnecessary to reduce the full 2 mm at this step, as you should leave some room for additional reduction during the finishing steps. Moving on to the buccal reduction of number 5, create 1 mm depth grooves in two different planes. For the occlusal portion, it should follow the normal buckle contour. Here you should make 3 depth grooves, one at the center of the buckle surface, and one at the mesiobuccal and distobuccal line angles respectively. For the cervical portion, it should be parallel to the long axis of the tooth. You should make 2 depth grooves here, one in between the center and mesiobuccal depth groove, and one between the center and distobuccal depth groove. The position of the tip of the diamond rotary instrument should be 0.5 mm supergingivally, as this can be used to help guide the height of the margin location in subsequent steps. Then, join the depth grooves together. Burr options include coarse to medium grit chamfer and tapered diamond burrs. There should be a taper towards the gingival margin so that your reduction tapers to meet the 1 to 1.5 mm buccal margin. Then, create a chamfer margin. This margin should be between 1 and 1.5 mm wide. Maintain a lip of enamel on the proximal surfaces to protect the adjacent teeth from damage. The chamfer margin should be 0.5 mm supragingival in height. The final buckle reduction is 1.5 mm with dual planes. Compare your reduction to the buccal lingual reduction guide using the probe to measure. Moving to the proximal reduction, orient the burr parallel to the long axis of the tooth on the buccal surface. Penetrate the tooth from the buccal and move the burr lingually in a sawing motion, carefully avoiding the adjacent teeth. Burr options include long needle or flame-shaped coarse or medium grit diamond burrs to avoid damaging the adjacent tooth or over-reducing the proximal surface. Retain an enamel shell of the proximal tooth structure to protect the adjacent teeth during this tooth preparation. Optionally, you can break this shell using a hand instrument. Hand instrument options include a hoe or a hatchet. Next to the edentulous number 4 site on the distal surface, create a smooth transition from the buccal reduction to the proximal surface. You do not have to worry about protecting the adjacent tooth at this site, because there is none. On the mesioproximal surface, create a smooth transition from the buccal to the interproximal reduction. In doing so, you will create a smooth chamfer margin. The chamfer margin should be 0.5 to 1 mm interproximally, and the margin height should be 0.5 mm supragingival. Ensure that the proximal wall tapers are approximately parallel or less than or equal to 12 degrees per wall. Compare your reduction against the occlusal cervical reduction guide using the probe to measure. Moving on to the lingual wall reduction, orient the burr parallel to the long axis of the tooth along the gingival third of the lingual surface. Optionally, create 2 to 3 0.8 mm depth grooves on the lingual surface that are 0.5 mm supragingival. Then, join the depth grooves together. Create and refine the chamfer margin. The chamfer margin should be 0.5 to 1 mm lingually, and the margin height should be 0.5 mm supragingival. Extend the lingual reduction and chamfer margin to meet the proximal reduction. The axial reduction should be between 1 and 1.3 mm. As a tip, be sure to avoid over-tapering the preparation at this point, as this can be very difficult to accommodate when creating the coincident path of draw with number 3. Keeping your axial walls under-reduced here is advisable for the same reason. The final lingual reduction is 1 mm. Compare your reduction to the occlusal cervical reduction guide using the probe to measure. At this point, do not move on to refining the preparation for number 5 yet. The bulk reduction of number 3 will be performed first in order to ensure that there is a parallel path of draw without over-reducing number 5. Now move on to the occlusal reduction of number 3. As a tip, half of the occlusal reduction is performed at a time. The other half is maintained for reference purposes. In this case, the buccal portion is performed first, and then the lingual, For a reference during the reduction, orient the burr parallel to the slopes of the buckle cusps on the occlusal surface. Create depth grooves along the ridges and primary grooves of the buckle cusps at 1 to 1.2 mm in depth. Burr options include medium grit chamfer end tapered diamond burrs. Then join the depth grooves together. Remove any roughness left by the grooves. Keep the occlusal surface in configuration with the tooth's occlusal inclines. Then, create depth grooves along the ridges and the primary grooves of the lingual cusps at 1 to 1.2 mm in depth. Then, join the depth grooves together. As a tip, ensure that the central groove is appropriately reduced, as this area is frequently under-reduced. The final occlusal reduction is 1.5 mm. Compare the occlusal reduction against the reduction guides. Use the probe to measure. For the buckle reduction, create 0.8 mm depth grooves. You should have 3 parallel to the long axis of the tooth, 1 at the center of the wall, and 1 in each mesial and distal transitional line angle. These should also be in 2 planes, similar to the number 5 buckle reduction. The tip of the diamond rotary instrument should be positioned 0.5 mm supragingivally, as this will determine the location of the margin. Join the depth grooves together. When joining the depth grooves together, be careful to maintain the 2 planes that you've created with your grooves. This will allow you to reduce according to the anatomic contour of the tooth. Then, create a chamfer margin. The chamfer margin should be visually or explore detectable, or between 0.5 and 1 mm wide circumferentially. It should also be 0.5 mm supragingival in height. The final buckle reduction is 1 to 1.3 mm with dual planes, corresponding to the occlusal third of the tooth and the long axis of the tooth. It should taper to 0.5 to 1 mm along the gingival margin. Compare your reduction to the buccal lingual reduction guide, using the probe to measure. For the lingual reduction, create 0.8 mm depth grooves. There should be 3 parallel to the long axis of the tooth. Then, join the depth grooves together. Create a chamfer margin that is visually or explore detectable, or 0.5 to 1 mm wide circumferentially. It should also be 0.5 mm supragingival in height. The final lingual reduction should be 1 to 1.3 mm, tapering to 0.5 to 1 mm along the gingival margin. Compare your reduction to the buccal lingual reduction guide, using the probe to measure. For the proximal reduction, orient the burr parallel to the long axis of the tooth on the buccal surface. Penetrate the tooth from the buccal and move the burr lingually in a sawing motion, carefully avoiding the adjacent teeth. Burr options include long needle or flame-shaped coarse or medium grit diamond burrs to avoid damaging the adjacent tooth or over-reducing the proximal surface. Retain an enamel shell of proximal tooth structure to protect the adjacent teeth during the tooth operation. Optionally, you can break this enamel shell using a hand instrument. Ensure the proximal wall tapers are approximately parallel to at most 12 degrees per wall. As a tip, the number 3 tooth on the accidental typodont constricts dramatically as it advances gingivally. Therefore, it's very easy to overtaper when reducing interproximally on this tooth. Be careful to keep your burr parallel to the long axis of the tooth while creating your interproximal cut. Remember, it's easier to create a taper later, but impossible to put the tooth structure back once it's removed. Compare your reduction against the occlusal cervical reduction guide. Now, as previously mentioned, we'll turn our attention to refining the number 3 and number 5 preps so that they have coincident paths of draws, no undercuts, and are smooth and continuous with the appropriate chamfer margins. While clinically it may be useful to use air cooling alone to allow for better visibility in this step, The accidental teeth cut easily, so it can actually be helpful to keep the water on so as to not gouge or burn these teeth. At this point during the exam, it may be useful to take a break for a few minutes. Your preparations may not be perfect right away, but further revisions and refinements will improve them. Refine the preparation of number 3. Refine the chamfer margin so that it's visually or explorer detectable, or 0.5 to 1 mm wide circumferentially, and ensure that it is 0.5 mm supragingival in height. We suggest a fine grit chamfer end diamond burr. Ensure that all cusps are rounded. We suggest a fine grit football diamond burr. Preserve the overall geometric contour of the occlusal slopes and primary anatomy. Remove J-margins using rotary instrumentation or hand instruments. Failure to remove a J-margin is included for the fail criteria, so it's very important to ensure that none remain. Burr options include medium to fine grit finishing diamond burrs. Round all line angles. For refining number 5, refine the chamfer on the buckle so that it is 1 to 1.5 mm wide. The chamfer margin should be 0.5 mm supragingival in height. Refine the chamfer margin on the proximal and lingual so that it is interproximally 0.5 mm wide, and so that the margin height is 0.5 mm supragingival. Ensure that you remove J-margins using rotary instruments or hand instruments. Then round all line angles. Again, special care should be taken to round corners from the facial and lingual to the proximal surfaces. Optionally, you can utilize the slow speed handpiece during the refining process. Ensure that the path of draw of number 5 is coincident with that of number 3, and correct the angulation of the walls and taper as needed. As a tip, use a large intraoral mirror to inspect the path of draw for number 5 and number 3 at the same time. No undercuts should be apparent on either tooth when the path of draw is coincident. As a clinical note, if it is necessary to over-taper a tooth to create a coincident path of draw, favor over-tapering the larger tooth, in this case, number 3. Finally, ensure that you have the proper reduction of all surfaces by comparing against the reduction guides using the probe to measure. On the CDCA ADEX exam, over-reducing is better than under-reducing. However, be sure that your preparation does not contact the reduction guide, as this indicates significant under-reduction. Evaluate the crown preparation and checklist of number 3 and number 5. Thanks for learning with